Welcome to the RSNA Radiographics Podcast mini-series, Choosing a Career After Radiology Training. I'm your guest host, Jason Kai from the Radiographics Trainee Editorial Board. In this series, we'll be talking to radiologists about career paths in academia, private practice, and industry. Today, we're joined by Dr. Timothy Klostermeier, an MSK radiologist at the University of Cincinnati. Dr. Klostermeier has a varied background in private practice, the VA, as well as academia. Welcome, Dr. Klostermeier.
Thank you. Thanks for having me.
Could you tell us your career story?
Sure. As I finished up my training at the University of Cincinnati, my residency, I had to decide, whether or not I was going to do a fellowship. And I, took a look at practices and decided that I wanted to practice in a smaller community hospital. And I thought at that time that a generalist was probably the best way to go. So back in my day, back in 1997. You passed oral boards and off you went. And so off I went to private practice as a generalist. I think it's important to point that out because we'll talk later in a second about my fellowship. But at that time, I practiced community radiology for 10 years, 12 years in a private practice and enjoyed it, read mammography, read nuclear medicine, did interventional procedures, read neuro, read everything. And loved it. It was it's challenging, obviously. But for me at the time, I really felt like that was the way to go. And so I spent probably 12 years. And then I transitioned over. I had an imaging center. And then I transitioned over into owning an imaging center and actually practicing from that imaging center. And that allowed me a little bit more flexibility in my life. It was a really, it was a good time. My children at the age that they were playing sports and everything, we'll talk about flexibility later, but it offered me the chance to, kind of have a little more set hours. It also, I think if you have an entrepreneurial spirit, it's a great way to kind of learn the industry. And I would emphasize that because if you're not interested in that, it's probably not the best way to go. But for me, it was great. We built the practice. I learned about insurance companies, CMS, how the billing system works, how revenue works, paying employees. But it was great. I really think we did a nice job and we balanced things out, and that was a lot of fun. And then from there, we sold the imaging center at one point because I wanted to transition to something else, and that was where I went to the VA. So I have experience at the VA where I spent about 8 years, and that again was a really challenging time, an interesting time. I took over a department and a section at the time when things were looking a little rough back in 2013 with wait times and things like that. So I had the unique opportunity of coming in and really trying to use my expertise at that point and then gain a whole nother skill set of, well, if we have limited resources in the VA, and that's not a negative, it's just the way things work. How can we prize every single slot? How can we get everybody seen that we need to get seen? And so we worked with some things and utilization nurses and things like that and worked hard. And then at one point I said, well, my kids are all grown up. How do I want to spend kind of the last third or quarter of my career? And I had always loved musculoskeletal radiology. I was always kind of the person that, took the harder wrist cases and these are things that maybe in the private practice didn't want to read. And so I called. It's great to have mentors, and it's great to have people that you keep in contact with your whole career, And I called Dr. Susan Braley, who I had known and was one of my mentors and still is. And she said, "Great, we'd love to have you back to do an MSK fellowship, but do you want to work as well?" So we kind of formed a little bit of a hybrid situation where I came back to the University of Cincinnati and I worked and also did a fellowship, and it was just great. I mean, I came back and fell right into teaching, just getting involved with the residents, and it's kind of why I'm on this podcast. I think is because I really saw, at least for me, the niche to all of them was this kind of experience that I had, and that I could, they had questions about all the things, and so that's where I'm at now. I'm on staff and enjoying myself.
Truly, that's a very incredible story, and you're the first and only radiologist I've met that have experienced the whole spectrum of practice, including running your own practice. And perhaps maybe I can find out a little bit more. How was it like to run your own radiology practice and be your own boss?
It's great, but with flexibility and with all of that comes responsibility. So I think you have to gain that business skill set that goes along with. And I always like to tell the residents, boy, radiology is hard enough, isn't it? I mean, it's a challenging field, it's a challenging specialty, and then you layer on these other things. And so, I found it to be interesting, would probably be the word, kind of delving into the world of revenue. I was certain that I could do a good job, and then I was well trained and knew how to run the practice, but paying employees and leasing equipment and building on a site is a whole different ballgame. And so you have to, find people that you could come up alongside you. I had a couple, I had one friend in particular who was an ER physician, but also had some experience in the construction industry that kind of helped me out to build out the imaging center. And then it's just a matter of learning. And it's a pretty, it's a steep learning curve at first, because you have to, there's the whole CMS, Medicare, Medicaid side, and you have to work through that in the billing. And you need to get a good billing service and audit the billing service. And so it's great because you have a lot of control. But on the flip side, I think there's you have to love business, because you're going to be paying employees and you're going to be running payroll and looking at your budget and reading films and doing everything. But I enjoyed that. I mean, I learned a lot and it was valuable.
What do you think are some of the key skills, attributes, and mindsets trainees ought to possess to flourish in academic radiology and private practice? And how do you think we should cultivate them?
Well, let's start with academics first. I think, academics, I mean, it's obvious, teaching is still paramount. Although you'll notice a theme throughout mine, because I've been in both realms. There is a merging going on of the two worlds. I see less and less differences as the time goes on, between academics in a way and private practice, because of the expectations in academics now for production and for things that are going on. And these are real things that residents need to know about. That, some of the time in the past, maybe it wasn't watched as closely, but now it's again, even the academic centers are just revenue driven, and that is, I mean, it is something that you're measured on. Teaching, though, I think is, for academic, is obviously paramount. I think it's great to carve yourself a niche. In my case, I'll give you an example. I like to teach approach. I think is important to me. I don't think it's taught enough about how do you approach a case, not just what's here, but exactly, if you have a trauma, thoracic spine, what's your search pattern. I like to tell the residents, look at everything, but look at it once. One time really well. Don't find yourself just power scrolling back and forth through a case. You get very focused, because that's how you will build speed and accuracy. Look at it once, but really, really look at it. I think in the academic world, you're going to have to, other things you have to cultivate. Well, certainly, you have to get used to a level of complexity that you maybe don't find in private practice. At the academic centers, you tend to have these cases where I like to tell the residents, there's not just one thing wrong, there's 4 or 5 things wrong, and you have to work through those cases. And I think also you should probably have a little more curiosity on cases, not to degrade what happens in private practice, but I think in academics, you'll follow cases out a little bit farther, you can get a little more involved in that. Switching over to private practice, I think, and I touched on this a second ago, you really have to cultivate your speed and accuracy. One of the things I like to tell the residents is I doubt anyone will be reading less cases next year. It's great. It's a great problem to have. In radiology, we're successful. People want our opinions. People want these studies. But I don't see that stopping, and I'm not sure we're even keeping up with. I don't know the exact numbers, but it would seem like we're falling a little bit behind, and even keeping up in a number of radiologists with the sheer volume of work. So I think everybody has to, you have to keep that ability to read quickly but accurately, and that's you have to work hard to cultivate it. And I would say it's probably that crosses over to both now. Mm-hmm. The other thing I would say with private practice, it's really true with both, is when I talk to private practices and they say, well, what do we want in a resident? This is what private practice tells me what they want in a resident. They want 2 things. They want somebody who's obviously knowledgeable, but has good speed and accuracy. And number 2 is they want really a good team player, somebody that they can get along with. And I think cultivating that in your practice, that the ability to be a member of the group, and again to be able to to be. I don't want to be. I mean, I want to be positive about this, but you want to be a good team player. Um, because a group doesn't want to hire somebody necessarily that's going to be a problem in a certain way. And so I think that's what they want to know. So and with those things in mind, I mean, I think that's just cultivation of that is merely just working hard and again asking the questions, and I think approach is a big one.
How would you describe the transition between academic and private practice? And what was the most challenging part of that transition?
I love that question. It's a good one. Um, for me, it was enjoyable because I had missed teaching, and I think in private practice, and again, I love this podcast. I love to be very honest with the residents. Just tell them this is the way it is. One of the things I found lacking in private practice, we were moving so fast through cases that if there wasn't an interesting case, you just kind of had to let it go. You just had to move on to the next case. Where still in academics, there's still time to gather your colleagues, get a kind of an opinion on this, kind of look at it. And I I found I missed that, the ability to maybe have still a little bit of time to look at a case, think about writing the case up, those type of things. So, for me, the transition was really nice because I came back, and number one is I could spend some more time in those cases. Number two, I could teach, and I missed teaching. I loved teaching, and in the private sector, you can find some chances. You'll have some people around, but for the most part, it's so geared towards getting the work done, that that was the best thing for me. I think as far as going from private practice to academics, I think it's hard. I
Oh,
think it's probably easier maybe to go the other direction, although I think both you have to kind of change speeds. I think for me, it was a challenge to come in and see more complex cases. Have to think about, okay, we're going to prepare a lecture on this and teach this. And you kind of have to re-gear yourself towards what you're doing. And I think, um, the skill sets of putting together a lecture, the skill sets of teaching, the skill sets of finding your niche, they're good, but it takes a little time. And I think, and I don't know, I think it's probably tough going both ways. Me having gone from private practice to academics, the fellowship helped a little bit because that was kind of a good transition, for me, to switch from one speed to another. Um, and then there's, I think in academics, we could talk about the pluses and minuses, but it's interesting. There's a little less flexibility in academics from a purely scheduling standpoint. I'm talking about my personal schedule. The schedules seem to be made 3 months in advance. They are where I'm at, and they're fairly rigid. Whereas in private practice, there was a little more wiggle room with your partners, or you could say, "Hey, would you want to cover this for me?" Something came up. You had a little more flexibility amongst, as long as everything was covered, the hospital was fine with that. And there's also a layer in academics too that I didn't really anticipate that has been difficult, and that is it's not just getting re-credentialed, it's getting reappointed, as professors. So there's a kind of added level of your CV, and making sure you're teaching and you're speaking and you're doing all these things. They're all good things, they're just different. And I think you have to get your mindset right. You have to kind of you get, again, make sure you on your protected days, or if you have any, that you're doing those things.
Dr. Klostermeier, was there anything that you disliked about being in academic versus private practice?
Um, it's great. That's a good question, and I think we kind of touched it, but I'll go over that again. From an academic side of things, I think it's there's a little bit of lack of flexibility, I think, with your schedule, and that I think was difficult. And here's another big one, that I kind of, when I looked over your questions that I wrote down, and do you have a little less control over your practice in general when you're academics? And that may not be important to some people. Some people are fine with that, but when you're in private practice and you're contracted with a hospital, you have that contract, and you have to honor that contract. And then within your private practice, you can figure out how are we going to honor that contract, the coverage, making sure everything's done, everything else they want, serving on different boards. And I think in academics, I was just surprised, because again, you're in a bigger, I'll say a bigger department because there's big private practice groups, but I feel like sometimes I don't have as much control over my day to day as versus private practice, where you can we can set that how we're going to do it. And academics, this is the way it's kind of done. It's the way we've been doing it. So it's a little harder to implement change, I think, on your daily work schedules, which really wasn't, immediately intuitive to me until I came to academics. And it's not really, I'm not saying that that's a make or break negative, but I was just surprised at how little it's a little bit harder to, say, well, what's going on with this, we got some broken microphones or whatever it is, trying to get those things corrected, could be a little more tedious. Let's put it that way.
What about private practice?
I would say the big thing for me is the focus on revenue. I think at the end of the day, right, it's you have to do it, but I think it drives everybody a little crazy. It's complex. How you're going to get paid, and the insurance companies, your billing service, and whether they're doing a good job or they're just getting the low hanging fruit. You're trying to audit them, and you're trying to add partners. You're trying to figure that out. And again, but it comes back to revenue generation. You can't have any. I mean, people have to get paid, and all of us in medicine, and we spend a lot of years with no income. We forego our 20s largely when other people are out making a salary, building a pension, whatever it is. And they go here, they go there, they go to Wall Street, whatever. And we forego that to age 32, 33, and you have to. And again, I'm very honest about these things, but you have to reimburse us to a certain point because of all those years we gave up on income. So, or it's just going to be harder and harder to get people to do it. And that's a practical matter. That's not about overly focusing on money or anything else, but that's the real world. That's the way the real world runs. And the real world runs on revenue. You can't keep a group together unless you're bringing in revenue, and you can bring in partners, you can bring in new staff when it gets busy. And if you find yourself dwindling away and the collections aren't as good, well, then somebody else whose collections are better at another private practice can offer somebody more and can get better talent. So there's this constant, it's a grinding drive for revenue. And I think it's okay, but it gets on my nerves a little bit.
Yeah, like when you said that you wanted to spend a little more time on a complex case, but it's hard because the list is so long and there are patients waiting. But then again, because of the increasing volume academic, and like you said, there's this blurring of these boundaries, and money affects everybody, and academic centers have to make money as well. So I guess it's an issue that affects everyone. Also, what's one piece of advice that you will give to graduating trainees still deciding where to practice?
It's great. I'm glad we came back to that because I touched on it a little bit, but I'll give you two though. I'll give you a bonus one. So the first one I would say is, and we talked about this a little bit earlier, is really your residency is a time and to get to know yourself as a radiologist, because you're training as a radiologist, and by getting mentors or whatever it takes for you to understand kind of where you fit in the spectrum of if you are more curious and but you gotta obviously you have to identify that earlier than later, because or by third year you're already trying to plan the rest of your career and interview and do all these things. So you just be honest with yourself about really what your needs are, and if you have a good mentor, good mentors, they can help you along with that. If you know yourself, and again, we spoke about this earlier, it's okay to maybe get in the wrong job and then have to go somewhere else, but no one really wants to do that. In my case, I enjoyed the journey. I enjoyed shifting careers and making jobs. But I think if you can be honest with yourself and you can find the right job earlier, it makes your life a little bit easier. I think if you get in a job and you're like, oh, I hate this after 2 years, then you got to kind of do something else. And so I think that's where it's valuable to really, really get to know yourself and really understand what it is you want. and they can be difficult. People can help you. So that's number one. Is I think just be honest with your speed, your accuracy, whether you're more private practice, whether you're more academic. Number two is, and again, this has been a theme here, is don't solely focus on the money. Try to resist that urge. Try to resist the urge to just look at jobs and say, well, this one's 500, this one's 700, this one's 400, the VA pays 350, whatever it is, and those are all real numbers. Again, that's important. You guys have student loans. You guys have foregone a lot of, you're trying to get your family started. You're trying to get houses. You're doing all this. I've been there. I understand all this. So money may be important, but try not to let it be overshadow everything else. Try to put it in the perspective with everything else, because you're going to do well in radiology, regardless. And again, I think sometimes I hear residents talking about that. I'll hear them talking about jobs, or so-and-so, there's $1 million job here. And I'm like, let me talk to you about that job. It's a good job. I'm sure it's a great job, but you're going to read a lot of cases.
Nothing comes for free.
That's right. There you go. That's right. Yeah, if there's one thing the residents will tell you is I'm honest with them. I think you have to be. There's no. I'm not sure. I mean, I think when I was in residency, I think I didn't really know anyone personally who was in private practice. I really had no ability to understand. So that's why I'm glad you're having this podcast. I was only getting one side of everything.
Yeah, and also just to relate to whatever you said about these job offers, and I'm sitting in the reading room and the fellow next to me is saying, oh, like I've got this email of $1 million at a desirable location, and a great lifestyle and great vacation, and everything seems to be very appealing. And I always wonder, what is the catch? Like, if it's so good, why are they looking for people? They should have been these spots. Must be a catch somewhere.
Well, you're smart. You're right. There's something there, It may be just a simple issue. You're just going to have to be working constantly, but that's probably it. But it's a good time to be in radiology. It's a good time to be a radiology resident. The job market's wide open. I think if you know yourself, you're going to find the job that you want. It's not a tight job market. It's wide open. And that's why I would say to all the listeners is that, this is a great time to be going out looking for jobs. There are a lot of jobs out there, and you'll find the job you want. Just make sure you know what job it is you want.
Thank you very much, Dr. Klostermeier. Very, very inspiring and insightful.
Thank you. Thank you, sir.
In the next episode, we'll be talking to Dr. Adrian Gonzalez, an interventional radiologist at the Memorial Sloan Kettering Cancer Center, about his experiences in academic radiology and as an Associate Fellowship Program Director. So stay tuned and remember to rate, review, and subscribe.